Hello, everybody. Here's Corona Fighters campaign, and we are glad that we have another episode of webinar with experts.
I'm really grateful to everyone who is here. I mean, this is not an easy time around the world for almost every country around the world. For some countries more difficult, for some countries less. It's also not an easy time for the people who are dealing with the healthcare issues at any level.
What is that makes this pandemic so unique in your mind, in your point of view?
There are many things can be said. The point is so unprecedented in any scale that we can bear in mind. I mean, colleagues and also professionals as well as politicians have made comparisons that I would more or less agree also personally. I mean, we don't recall anything like this in recent history of human being in terms of the size of the disease, the sort of the scale of the challenge and burden that is putting on the whole society as a whole. And because being a disease that is contagious, relatively very fastly distributed, not having a very specific treatment for it at the moment, so there are options, but then none of them are best options for treating at the moment. So we are still looking for the best options, not being able to vaccinate against it. And at the same time, so putting a lot of burden on the healthcare setting. So that means it not only is about affecting the people who are tackled by the disease. I mean, they caught the disease, unfortunately, but anyone else who needs healthcare is also affected because this disease is putting pressure on hospitals, on healthcare settings, on the provision of medicine services around the world for everything. So then it's quite big. Some people are comparing it as to being the biggest pandemic since the influenza pandemic after the First World War. So, and probably that's not a bad comparison. Although in that pandemic, many people lost their lives. I mean, and when we hope that with this pandemic, there will be nothing even close to that figure. And with the response and the capacity of the system is probably that's the case, but it doesn't make it smaller in terms of how it's affecting. It's affecting economy, it's affecting healthcare, and it's affecting even the social interaction of people together. It's affecting politics, how the things are being run. And there are a lot of lessons to learn from it for all of us in any aspect of life. But right now, the main focus is, and definitely that's for WHO, to do things in support of healthcare systems, and every Ministry of Health around the world are doing that. So, I mean, it is a unique experience, and that's part of the challenge. A lot of things that we know that might be effective or might be helpful, none of them have been tested against anything like this before. So that's also putting a lot of challenge in terms of lessons learned. And that's why within the last several weeks that the start of the outbreak and the pandemic, there has been changes in some recommendations because we are learning as we go forward as well how best to respond to the pandemic.
One of my questions is that can we predict the outcomes of the pandemic like this based on the pre-existing capacity of the system? For example, some quantitative indexes, something like the number of ICU beds per capita or something like that.
Yeah, but I mean, sort of, if we think of at a national level, let's forget international comparison. Let's think of inside the country. If we think of inside the country, if a country has more ICU beds and also better distributing the ICU beds, I'm not talking about single beds here and there, it's actually ICU wards that are well equipped and well distributed in the country. It's not just the numbers, it's also the distribution of the beds in different parts of the country as a whole. So if you have more of these resources in terms of responding to a disease like this, you respond much better. You have a capacity to spare, you have a capacity to respond. It's also if you have trained your system better in terms of the sort of what you call it, the infectious control measures. So if the hospital processes or the healthcare processes are better equipped by infection control measures, that's also you do better. And these are about the capacity of the system that you have. Also, if you have enough number of doctors that are well trained, if you have enough number of nurses, if you have a good supply chain to distribute resources, if you have internal capacity to produce the things are needed for the country. So by all means, this is a disease. This is a pandemic. It's testing every aspect of healthcare system. So if you have had the chance, a country, if a country has had the chance to expand those capacities, they do much better. But then when we compare between countries, the comparison is not that simple. First of all, the way the countries define such capacities are not the same. So I mean, an ICU ward in one country may not be exactly like the ICU ward in another country. So the effectiveness of the measures between those are not the same. So when we compare, we cannot just go with a sort of simple comparison. It's also the needs of the countries might be different. So for example, if you have a society that the population is naturally more dispersed, is distributed through the land, even if you have a large population, but if people are naturally distanced from each other, so that the sort of travel of the disease from one person to the other would be more difficult, then the system responds better. If you have condensed populations, then obviously those contagious things happen more quickly, and so the needs of the societies would be different compared to the number of ICU beds, for example, that you highlighted. If the society is more elderly, and or the comorbidity rate more or less would be similar, but I mean the age distribution. If the society is more older than another society, again the needs, potential needs, could be bigger. There are also other theories that other sort of aspects can affect it. But what is extremely important is the capacity of system to respond. And this capacity is not just at the treatment level. It's also at the level of diagnosis. It's at the level of identification, follow-up, sort of the system, how it goes. And also if as a patient, I have the disease, or I'm doubting that I might have the disease, I might have a sort of sign and symptoms, do I have access to get the resources I need? So I mean, is a doctor around that I can contact? Is a telephone line I can call and trust? Or is there enough, what do you call it? Yeah, I mean, enough resources to respond to my request there. I mean, all of those, if I don't feel those, and or for example, if it's too expensive, I'm worried about. Yes, it's also about the barriers. I mean, so let's say you might have capacity, but the system is not paying for the service. Then you will have sort of, you have to pay, and then it becomes a barrier, and then you don't go to receive the service. It becomes too late. Then you become a source of problem for the society because other people catch it from you. So in a way, you know, this pandemic, everything that we discuss in a health policy course, in a health system development course, is actually showing how important they are. So in a normal day, we might argue that, well, I mean, we've done it the other way and it has not been a disaster. But now it shows that, I mean, every basic things that should have worked properly, if they work better, you as a society respond better to the needs. So yes, I mean, your question, capacity is absolutely important. And if a country has been lucky enough to invest on those capacity issues, they respond better. But then in any given country, you really need to improve and you make it further and you sort of use the resources in the right way.
So it's not like an unmodifiable variable. It's something that you can change even in the course of the crisis, yeah?
Absolutely. I mean, there are very good examples there. Let's think of it. I mean, so the capacity to diagnose the disease, not by clinical sign, but I mean, using laboratory system. Almost most countries, not perhaps, I mean, we could say before the disease was identified, no country in the world could identify this disease. So there are a lot of capacity. So first it was the identification of the sort of laboratory procedures that, and the kits and the sort of reagents, the system that can make it possible, but then building that capacity at national level. So you go to a country, even if there are people who can do it, are these people who can do the testing, are they well distributed around the country? Is there quick access to that? And what we have seen is that the countries, the first few weeks, some countries have had capacity challenges. to do the testing as required, but they've learned how to do it better. They've expanded the capacity to do that. And some countries that prepared themselves earlier or were lucky enough that the disease arrived a bit later, so they had the opportunity of learning from other countries that were dealing with the issue, they became better prepared. So, but I mean, that's a good example. So, I mean, the way the laboratory capacities are being expanded in response to this outbreak, I'm sure this will remain for future as well for the countries for other similar things. And similarly for the reuse of, I mean, sort of redistribution of resources in terms of hospital beds, redistribution of the public health capacity in terms of how to change the processes. So, I mean, so I don't want to name countries, but in many countries you can say, you can compare how they reacted to it in the first couple of weeks or less few weeks of the outbreak coming, the pandemic coming to the country, and then after a few weeks. And almost every country is responding better after a few weeks because they're learning how to the healthcare. But here I'm focusing on healthcare aspects only. Obviously, it's not only the healthcare aspects, there are many other aspects that come into it.
And how do you think this crisis, this pandemic, would affect our perception of health systems and the future of them? Is it socializing the system? Are we going to have more centralized systems, health systems to address these issues?
Yeah, I mean, this is a good question. I mean, reality is, I guess, many of the people who are really dealing with it at national level probably do not have time too much at the moment to think of these things, how it's going to affect. So they observe it, the ideas come, but then we are also waiting to see how it affects. But my own assumption is that it will have lasting impact on the way the health systems work. It's showing a lot of things that we assumed they would work perfectly. They didn't work perfectly. A lot of issues that we had in the health system, we thought they will be able to handle because they had never been tested with a challenge like this. The limitations have shown themselves. The other important thing is that it's showing that a lot of tasks can be shared among staff. So many health systems had become super specialized. You do this, and I do that, and you do that, and then we have our own specialty of work. This COVID-19 showed that there is a lot of potential for task shifting. There are many things that many more people can do it than the ones that are assumed on paper. That sort of in the way that the health system are set up. I mean, if you call socializing in that way, yes, this is quite likely. It's also showing a lot of potential for remote care, whether the remote care is about prevention, is advice, but also it's about treatment. So in many health systems, they are asking people to stay at home, for which 6 months ago, no health system would advise that person to stay at home. You tell the people, stay at home, do this and do that and do that, and you give advice and get the setup. And if you have this sign, come to us. So this level of, I mean, transferring the care from the setting, formal setting to home setting, again, this has not been seen before. It's also bringing many of the health elements of health sector closer to each other. So when it becomes to pharmaceutical, I mean, supply chain, decision-making process, to the lab issues, to sort of the vaccination, I mean, sort of processes. When it comes to the level of, I mean, the tertiary care, secondary care, sort of, I mean, primary care elements. Community pharmacy against the source of service delivery. A lot of functions are also coming together. And it's also bringing more the social providers of care, I mean, not just the healthcare, but also other aspects of the system to much more closely together. And it's also giving an opportunity to appreciate more some of the responsibilities that has been done in systems, but then perhaps people didn't appreciate the role of those groups much better. Put all of this together and think about it, that the changes that it will affect the health system will be quite substantial. It doesn't mean that after the pandemic, that inshallah will come sooner than later. After the pandemic, there will be immediate effects, but the effects of it on the minds of policymakers, politicians, even the society as a whole, as well as the health sector, are quite large. So there will be substantial effects on many aspects of healthcare delivery and healthcare systems around the world.
And let's jump to your position. We're asking about your position. What do you think will happen to WHO? Will this crisis affect how we see that as a system that is prepared for combat with this kind of problems? Can we witness a more resourceful institute after this crisis? Can we rely more than before on the WHO?
Yeah, so this is an important question. World Health Organization, the WHO, the way it works is actually an organization that is, we call the secretariat, the language we use. We usually say the secretariat is also member states. So it's not something that is separate from member states, from the ministries of health and also the national systems that work. A lot of the functions, decisions, the key decisions are made by the countries, and actions that WHO does in countries is always either in response to the countries' raised sort of demands, so saying that I need this and I need this help, or with definitely at least with their sort of their agreement. So is that WHO finds a need and then highlighting that to the country agrees, and then WHO acts. So in that sense, what we see is that WHO being very much more closely working with the countries. But then there is a bigger change in here. The bigger change is that, the role of WHO has been sort of, it's not something related to this year's, it's been for many decades, a key player in the sort of well-being of the human sort of race since there is conception. But within this crisis, that role became much more mainstream. With the sort of position of WHO, the advice of WHO was taken much more seriously, was followed much more vehemently in terms of the processes. But at the same time, it also showed that, some of the issues that WHO can do, probably more resources is needed to expand on those issues. And those issues are not just about money, it's about human resource capacity and also the capacity to sort of move around better. I can give you one example. So let's say there is a country that needs technical support. Humans go into the country and help the country. The country asks for it. WHO wants to send people there. But right now, for many countries, this is not possible because there is no flight. The travel, it becomes so restricted. So, the issue is that the setup that we have in international relations, that has the changes that has been made as a result of response to this crisis is also limiting how the system can respond to the crisis itself. So that's these are the things to consider. From WHO, at least in the last few years, it's been a lot of further emphasis on the presence at national in country levels. As you know, WHO has country offices, there are regional offices, and there is a headquarter. So there has been quite a lot of pressure from within WHO and planning to expand the capacity at the country level when it is the front line helping the countries. So this crisis is showing that that's absolutely essential, because you might have the capacity, but if you are not in the country, you may not be able to help the country. And if the country borders are not available to you because of flight cancellations, sort of limitation of movement that many countries have put in place, some of them temporarily, some of them have become longer period, then obviously that becomes a challenge. The other thing to bear in mind is that, as I said in response to your first question, this is a pandemic that no one had seen before. So obviously, there is also lessons for WHO to how to transform itself to a better shape, to respond better, as health systems are also doing that. When Ebola crisis happened and the Ebola epidemic happened in in some countries in Africa and affected few countries outside Africa, there was a call for revisiting the way WHO works, and WHO actually adjusted itself to have a better response to such situation. And I would say those lessons actually helped WHO to do a lot better in response to COVID-19. I'm sure more can be done. And the other lesson, so I'm not part of the emergency program of WHO. WHO has an emergency program. Naturally, when emergency issues come, colleagues of emergency program respond to it. Our role is that they call upon us when they need us, and then we help. But right now, exactly now, and within the last few weeks, I would say about 60% of my time is actually focused on emergency. I'm working as part of the emergency team, and it's happening almost all across the WHO. So everybody responding to it, everybody working so closely. So what you see at national level, that everyone coming together to respond to COVID is also happening. So there are lessons also for WHO to how to streamline better, how to join the resources better, and how to be more prepared, God forbid, if something like this happens in future years again.
Can we tell for now that which strategy has been more successful in combating the COVID-19? For example, we heard about quarantine, active patient screening, and lockdowns, tighter lockdowns, looser lockdowns. Do we have enough information to conclude which one of them was more successful?
Yeah, so if I put my researcher hat, so to be able to say which intervention is more successful, it's not an easy thing to do. You really need to have the opportunity to assess carefully, to see all the details. I mean, the examples of intervention that you mentioned, I mean, you use single words for them, but every country actually has done it differently. So they are not necessarily the same thing when different countries use them. Even in one given country, they use the same term, but over for example, a few weeks, 2 weeks they do it like this, the other 2 weeks they do it a bit differently, they learn from the experience, they change it. So, I mean, and those make it more difficult to assess the effects. However, when you are dealing with the crisis, you are not talking about research scenario. So you are not talking about the things we can do next year, when we can look at all of these and give better answers. We actually need the answer now. We needed the answers yesterday, not even today, to be able to to do that. So there are things that are clear, and some of them have been highlighted very clearly in the words of the Director General of the WHO and also the Regional Director, Dr. Al-Mandari, so that certain processes are very clear. For example, the capacity to be able to diagnose patients quickly. I mean, the testing capacity. Expanding of that and expanding the level of testing is absolutely essential. So I need also to clarify what I mean by that. It's not just about testing. It's actually to be able to do the testing and then know the answer quickly as possible, and then have a plan to act on it. So it's not just about counting, it's actually be able to learn from that experience. So if I have the signs and symptoms, even if the only thing you do is that you tell me you are positive, I change my behavior. I become more careful. I talk to my family. I explain to them I mean, we need to be a bit distant. I've been more careful when I go outside. So by just doing that, I actually help the rest of the society to do better. I mean, so knowing that, the health system also knows much better, because if they see I'm positive, they see, okay, so he's positive, where did he get it? What was the source of distribution? Who might have caught it from this person? They would check this, what we call the patient tracing, patient contact tracing. So you go for it, and then you plan for it, and then you distribute. So especially this capacity to test, I mean the capacity, if you remember, there was a very famous saying from, I say remember, it's not very far away, but I mean there was, this pandemic is so full of, I mean, information and messages, is that so the Director General mentioned test as a sort of emphasis on the process. But then, so if you can do that at the national level, perfect. I mean, but then if it becomes too big in a country, and the country is large, or the distances are huge, the capacities are there, it may not become that possible. You need to expand the capacity to try. But then the other things that, if let's say, imaginary situation, we all know that who is positive, who is negative, and we are sure the answer is correct. And then among the positive, we know which one of them needs to be in hospital, which one of them doesn't need to be in hospital, which one needs to receive this treatment while at home, which one of them stays at home and not needing that. And anyone who needs to go to quarantine can be sent to a center that they will be isolated from the society. And when we talk of quarantine, quarantine in country A is meaning very different from country B. Just imagine, there are certain countries that about 40 to 50% of households have only one member. There is one person living in that household. If you are in a country like that, quarantine is not that difficult. You just say, go and stay at home. But if you are in a country that the average household size is 3 or 4, then quarantine is not just go at home, because you go at home, but then there are other people around you. And we know it's so difficult to quarantine people when they are at home with the people around them. So then the issue becomes, can I separate from household for 2 weeks, for 3 weeks, so that the person becomes safe and then go back to the household? And how can I also issues of social distancing, etc. I mean, the physical distancing message that has come forward. So then it becomes, then you want to do the quarantine, and then you go for the lockdown approaches, saying that you banned, and countries have done it in so many different ways. There has been countries that they actually banned people going outside home. So it was you would go only if you have certain permission for certain needs. Otherwise, I mean, there will be considered as the offense in terms of you could be fined, or in even some countries they're partial in reaction to people like not following the orders like that. But then other countries have been about restricting travel from one location to the other. In some countries of the region, all internal flights were cancelled. So there is no plane traveling for a few weeks inside the country, not just outside the country, but there is no flight also inside the country. There are countries that they stop the train travel, So you do these things sometimes you do that, it's a different strategy. You want to slow down the spread from one place to the other place. By doing this, you give capacity to the health system to be able to manage the cases that are there, and also be able to, if someone becomes a bit later having the disease, to be managed. And we know that capacity actually saves lives. It's not just about numbers. It's actually, if I have the ICU bed ready and empty, and if my doctor is ready to do that service, and my nurse is ready to do that, and my medicine is ready to be given to the patient remains alive. So all of them become together. So if I go, the testing strategy is absolutely important. The issues of physical distancing. Physical distancing is also about we are now very well physically distanced from each other. But then, the issue becomes, if I might go to a meeting and be close to other people. I should not do that. I should be extremely careful on that. We heard that the WHO advice on the use of mask, non-medical mask, has become more widespread, saying that actually use it in many other social encounters that was assumed may not be needed before. So the issue is that you actually use the physical barrier more to distance yourself. In the healthcare setting, the use of using the personal protection kits, the services. On the other hand, we also know that the proper use of them is important. So if I go back again to your question, I mean, the testing strategy, the capacity to do that, the issues of physical distancing, and anything that makes the physical distancing possible, so without going to the details. And then the issues of the whatever that separates the person who has the disease from the people who do not have the disease. So let's call it general category of quarantine measures. And then the last one is the issues of what we call patient tracing. So if you know someone, you really need to identify them. You need to know what they are doing, following them. And also, if the population is large in the country who are affected, they need to be able to approach you so that they know that when they have to call you, when they need to call you, and when they get to you. So altogether, I mean, there are a plethora of that things can be done, but these plethora of options are limited to certain categories, as you highlighted in your questions. And within these questions, it's not just selecting one of them, it's actually doing it properly as well. So as I said, I mean, example of testing. Let's imagine I have the capacity to test everyone in my country, in my province, wherever. But then if I'm not reporting the test soon enough, doesn't help. Let's say I do the test and then I report, but then I do nothing. It's not enough. So, I mean, all of these are, when they are part of a package of programs that go together, then together they will become something that is more effective. And sort of, I mean, these are things are easier to discuss and much more difficult to implement in practice. But then also they are providing a lot of lessons that countries are using and also learning from each other experience on how to do it better.
An important question is that are policymakers actually listening to these recommendations by experts and researchers? And a deeper question is that should they actually listen to these recommendations? Are these recommendations based on some solid models, or it's just like another thing in science? We don't know. It's a black box, and it's as much as we know, and we cannot be sure if the scenario would go another way.
Yeah, I mean, sort of, you ask a very important question, but you also ask it in a very tricky way. So I'm happy to say most of my professional life has been focused on this question, on how to enhance the availability of evidence from research or from data, from experience, the evidence for policymakers to make the right policies and implement them correctly, and how to make that possible. So I've been involved in generating that sort of evidence to assess why they are not followed or not being followed, and also developing systems to make it possible. So the question is very close to my heart, really. And when I sort of tackle it, I don't see the question as a black and white question. First of all, bear in mind that expert opinions are not necessarily the best evidence. So experts might actually bring that sort of the opinion from personal experience that might be biased from one source or the other. So if I'm a policymaker, and if an expert comes to me with a recommendation, it's a fair thing to ask to the policymaker. So you don't have to follow, you really need to check and assess. But then there should be a system to do that. A system doesn't mean a very complex thing, but you should have a process to assess the advice, to identify the best advice, to check it, and to plan according to that. That's what we call the sort of institutional capacity for evidence-informed decision-making. So I use the opportunity to say that in this region, in the Eastern Mediterranean region of the WHO, the Ministers of Health last year, they approved a program to enhance the institutional capacity for evidence-informed policymaking at national level. We were at the very earliest stages of doing this program in the countries when COVID arrived. And with the COVID issue, obviously, what we are realizing is that actually this capacity is absolutely important on all aspects of it. Because sometimes, I mean, I might listen, if I'm a policymaker, I might listen to an advice or even to a research study that is coming, perhaps not perfect, not being well peer-reviewed, not well assessed, or certain data which is not best presented, best analyzed, is not very representative. And then I might make a decision that is not the best decision for my sort of catchment, for my country, for my people that I'm responsible for. So what sort of process can help me? The other issue that I need to handle is that, so do I have enough evidence to answer? And this actually showing that very, I've said with a smile, but it's a very dark smile, is that with this COVID-19, a lot of the questions we are actually asking them for the first time in the context of something like this. Because nothing, as I said, in the sort of many, many years has been similar to this. Many of the questions are being revisited, they need evidence. And then do I have a system to learn very well from the system? Am I using my resources for learning very well? Am I using all my capacity, the data that I have in the country, to help me to make the decision? If I hear country A doing something, and then they say they are successful, how can I be sort of sure that what they are claiming to be successful is actually helping me? What we see also important that sort of sometimes the experiences that may not be the best experience also transfer. So something happens we see is happening in another place, we think, oh, it might be helpful to me, we try it as well. So there may not be they're very well checked. What I would say, the process of decision making is absolutely important. This process of decision making should look for the best available evidence at the time. Best research, best data, best resources. Use the expert advice and then criticize it in an open way. And use the national data, what we know about what's happening in our country and how our country works. And the people who know that best are the people who are in the country, who are making those decisions. All of them together making decisions. And then being also very critical to observe how my decision is affecting my outcome that I'm interested in. Do I need to adjust it or not? If I have all this process, I have the process. And within that, so my answer is that, yes, sometimes you listen to the advice. Yes, sometimes we should not listen to advice. Sometimes the policymaker sort of process needs to be changed. Sometimes it's working well. So if you are not talking about specific cases, but what is absolutely clear to me, this COVID-19 pandemic is showing that the importance of evidence-informed decision-making is more than ever.
Is there any possibility that we can be more prepared for a disease like this? But as I'm fully aware that you said it's something unprecedented, but can we be more prepared for the second time? For example, another virus with, air transport transmission, something that can spread so fast with considerable mortality rate and no precedented drug or vaccine that can help us. Is there any possibility that we can be more prepared for such thing?
Yeah, I mean, so the question can be asked two ways. One is that could we have, I mean, the global community, could it have been more prepared for anything like this? I mean, if you remember, I don't know whether at the time you were a student in medical school or not, when then the SARS epidemic came. So, I mean, the global community was actually as worried at the start as they were worried at the start of this pandemic. But then the world was lucky because it was not as fast as this one in terms of progressing. I mean, the SARS had higher mortality rate, but it was much slower for spreading. So it allowed the systems to control it. Since SARS happened, there has been quite, speculations among the academics that a similar virus might come. So if that's happened once, it might come again. And if come again, it may not be as, sort of as slow as previous one. It might actually become faster. So the idea was around, but the world, preferred probably not to think about it too seriously in terms of processes. Now it has happened, unfortunately. So then obviously this question remains. We definitely could have done better. I mean, as you are aware, there is something called international health regulations. So it's a sort of WHO governed process that all member states of the WHO are members of it. It talks about how countries should prepare themselves and also should protect other countries against such sort of hazards and effects that affect other countries. Within IHR, as we call it, there are a lot of processes, recommendations that need to be followed, how the national system works and how the link between national system and other countries. What is the minimum thing that is really visible is that whatever advice we had under IHR, we should be much more serious in implementing it in every country to safeguard the whole humanity. It's not just about one country, it would be to help safeguard the whole humanity. If IHR systems are working better, countries were doing better. Would that mean also further improvement of those systems? Absolutely. Those are also needed. The examples I gave and many more things that you can see from the literature, the discussion, and also the briefings that WHO is giving, there are many lessons learned that can be used there. But the answer is we actually have no choice. We should really try to do better and to take it more seriously and do it much better for any future hazard as this one that might happen. We could have been more prepared, but no one predicted something like this. Definitely now, I mean, there is a responsibility for everyone in the healthcare at the global level, national level, to be more prepared to respond to such a thing in future.
What about long-term effect of COVID-19 on pulmonary system? What do you think? Is there any prolonged consequence that we should be concerned? Something like chemical agents, something like real agents that had some long-term effects on the people and patients that we can expect to be seeing in the future?
Yeah. So, I mean, this is a very clinical question, so it's not my line of expertise. I mean, so the clinical projection. So, what we see, at least in the short term, that people who recover fully from the disease, they recover. So, I mean, there has not been a lot of reports on the long-term effects. But as any pulmonary sort of infection, that if it affects heavily the lung, it might be side effects. But I'm not the best person to answer this question. So what I see is this is not a major question that at least at the moment being addressed. So we are really focusing on treatment, and it seems that patients, when they recover, they recover. So, I mean, which is a good.
Is there any, considering the cultural status of Iranians and other their belief toward policymakers, what do you think would be helpful to enhance better risk communication? I mean, it's something about trust between policymakers and other stakeholders like people and insurance and something like that.
Yeah, I mean, so this is a very important thing in every society. I mean, if I give advice to the society, if people trust me that I'm having their best benefits in mind, they listen to me more. So that's quite important. I mean, it helps in every country, every setting. The reality is also when the healthcare system functions better, the society also starts to trust it more as well. So what we see as well is this is not a static situation. So let's say for some reason people may not be trusting the policymakers dealing with the health issues for one issue or the other. But then when the crisis comes, they're actually more likely to listen to the healthcare professionals, the society as a whole, when they see they are on the same page. And so I'm not aware of specific studies for a specific country, but what we also see across the countries is that usually the healthcare sector is one of the most trusted sectors in any society. So obviously, as I said, I mean, if people think that there are other motives for the healthcare delivery, so people obviously naturally wouldn't listen to that. But if they also see that the motive of the advice is to save lives, to make the society healthier, then everybody listens. So, but I mean, absolutely, the trust is absolutely important.
Is there any chance of second or third wave of outbreaks? Should we be concerned?
We should be concerned, yes. This is one of the possibilities that is being discussed. The nature of it and the details of it is not very clear. There are some questions that are not very clear. The first question is that when people get the disease, how long the immunity will remain? So there are reports that showing that immunity may not be very long, but at the same time, there are not large-scale studies that we know the answer for sure. So how long that period is. The second is that, so the second wave is not just about people who catch it and then they might re-catch it. It's actually about the parts of the society that are not infected in the previous waves. So then we see that in sort of such epidemics very often. So the issue is that, so let's say the disease comes to a town. I'm talking about an imaginary town. 5% of the society, the town are infected. 5% might seem a small number on paper, but if this disease is serious, it's actually quite a panic in every city if you have 5% having a serious disease. So then everybody becomes very careful. People change behavior, the system responds, there are restrictions, etc. Then the things start to go slowly. The society feel that it passed through us. Then the society becomes a bit relaxed. The disease can come back again from a small number of clusters that are left. it goes through the rest of the society and then it becomes bigger. So that's why, I mean, so there are some speculations that we might expect to see sort of in a few months if there is no vaccine identified and not become widely available within the next few months, which is unlikely to be the case. If there's physical distances, social distances measures are not very well implemented, there could be new waves coming. So this is actually one of the things that has made policymakers quite concerned, and a lot of plannings are because of this, because the assumption is that it may not be something that disappears quickly. It may continue for a longer period until we have a vaccine that is effective and also available to the societies.
Is there any possibility that rapid tests can let us go back to work and with peace of mind? I mean, is there any possibility that very rapid tests, something like tests that result in 15 minutes, can change the situation and prevent the second wave, and at the same time let us to go back to work?
So, I mean, as I said, I mean, testing capacity is a very important issue. But if you remember, in response to one of the earlier questions, I mentioned it's not just the test. Whatever goes with the test, the whole package would make it possible. So let's think of, imagine you have a test. We don't have that at the moment. But imagine we have a test that is available, easy to done, and gives response, say, instantly, 15 minutes, 30 minutes, 1 hour. So it doesn't matter that much, very quickly, in a quick period of time. So will the test on its own change the picture in a big way? Probably not. Because then what's going to happen to the person who's going to be positive? Will the person be allowed to go to work or not? Who is going to monitor that? Because if the person goes, then, because you know, the issue is that if you get positive, there is a percentage of that population will be highly affected. So many people will not have a serious issue. About 20 to 30% would have serious issues. About 10% would need ICU beds. And then it could be, I mean, anything between 2 to 4% might die from the people who that sort of. So that's quite a big proportion. So just finding the test would not stop it. The test should also be followed and should be acted upon. There should be a system to separate, and that separate should be followed, and we need to identify how the patient got it. So I mean, testing on its own, no, will not test, but testing is an essential factor. I mean, one of the reasons that in many countries it expanded the way it expanded, this outbreak and becoming a pandemic, was because the capacity to identify the patients was not strong enough to do that. So I mean, I repeat again, it's absolutely essential, but on its own, it's not a game changer. The game changer is actually vaccination. Mm-hmm. The vaccination effective, sort of available, that's the game changer. Without vaccination, the package of programs together are the game changer. So you have the testing, you have the separation, you have a good treatment, and you do the follow-up, and then you implement it very carefully, all of those aspects together. That together becomes the effective package.
What's your idea about the speculations on the effect of warmer weather and, you know, change of the season on the spread of disease? Can we be something optimistic about that, or should we be more pessimistic?
Well, I'm extra cautious in making extrapolation based on incomplete data. So I mean, everybody loves that this theory is correct. I mean, so all of us pray that this is the case. I mean, it behaves like influenza, and sort of in warmer weathers, it would become sort of slower, gives the opportunity, breathing space, and then the capacity to respond better. There are certain indications that it might be in one way or the other, but these indications are not very strong. I mean, so there are certain warmer countries that they are actually having high level of infections distribution. In many countries, you don't see much difference between the colder province and the warmer province in terms of distributions. So I mean, if the So, I mean, if the change of temperature of 10, 15 degrees doesn't change much, the distribution level, then you are not really sure what would be the change required. And we also see the disease at the moment on some of the countries that are actually on equator. So the numbers they are reporting on those countries is not as big as some other countries, but we don't know really, is that sort of an epidemic that is still growing? Is it the capacity that we may not catch every patient that has got the disease yet? Or is it the real thing that the maximum, and then we all be happy saying that the warmer weather might work better? And the other thing to bear in mind is that, so let's say in any country, when the seasons are very different from each other. In the cold season, people are closer to each other, naturally. Warmer seasons, people are more separate from each other. The windows are better open. So the chances of catching from each other is much lower just because of the way we behave. The behavior of the human would be different. So that definitely will be there. But the theories are not very strong at the moment, so there is no confirmation of whether it will be the case or not. So my thing in terms of the policy-making process is that so we should assume if it's not going to happen and we work as if it's not going to happen. And if it happens, then everybody will be happy. The other alternative is that if we think it's going to happen, but it doesn't happen, then that will be a very risky to the country.
Very grateful to the Tehran University of Medical Sciences for organizing such opportunities for sharing of experiences and knowledge. And yeah, many thanks.